Question 1. To address the challenge of managing combat casualty pain without immediate access to advanced pharmacological agents, which of the following non-pharmacological pain management techniques, consistent with TCCC guidelines, is the most appropriate initial intervention? Option A. Engaging the casualty in conversation about their home or family to provide distraction and a sense of normalcy. Option B. Elevating the injured limb above the heart to reduce swelling and throbbing pain. Option C. Administering a broad-spectrum antibiotic to reduce inflammation and associated pain. Option D. Applying a tourniquet to the injured limb to restrict blood flow and numb the area. Correct answer is A. Engaging the casualty in conversation about their home or family to provide distraction and a sense of normalcy. Explanation. The scenario is professionally challenging because it requires immediate and effective pain management in a high-stress, resource-limited combat environment, where the casualty's ability to communicate pain levels or preferences may be compromised. The medic must prioritize interventions that are safe, readily available, and align with TCCC guidelines, which emphasize minimizing harm and maximizing survivability. The correct approach represents best professional practice because it directly aligns with TCCC guidelines for non-pharmacological pain management. These techniques, such as distraction and positional relief, are universally applicable, require no specialized equipment or medications, and can be implemented immediately by any trained combatant. They are ethically sound as they aim to alleviate suffering without introducing the risks associated with pharmacological agents in a tactical setting, such as altered mental status or respiratory depression, which could further endanger the casualty. TCCC specifically advocates for these methods as initial steps before considering pharmacological options, ensuring a systematic and safe approach to pain control. An incorrect approach that relies solely on verbal reassurance without attempting any physical or psychological intervention fails to address the casualty's pain effectively. While reassurance is a component of care, it is insufficient as a standalone strategy for significant pain and neglects the TCCC mandate to actively manage pain. Ethically, this approach could be seen as a failure to provide adequate care. Another incorrect approach that involves administering a potent analgesic without first attempting non-pharmacological methods or assessing the casualty's condition thoroughly violates the TCCC principle of care under fire. This approach introduces unnecessary pharmacological risk early in the treatment continuum, potentially masking critical signs or causing adverse effects that could complicate further tactical medical care. It bypasses the tiered approach to pain management advocated by TCCC, which prioritizes safer, non-pharmacological interventions. The professional reasoning process should involve a rapid assessment of the casualty's condition, including their level of consciousness and ability to communicate. The medic should then systematically consider and implement TCCC-recommended non-pharmacological pain management techniques, such as distraction, positional relief, and environmental control, before progressing to pharmacological options if necessary and indicated by TCCC guidelines. This tiered approach ensures that the safest and most effective interventions are utilized first, minimizing risks and maximizing the casualty's chances of survival and recovery. Question 2. Strategic planning requires a medic to assess the immediate tactical environment to ensure the safety of both themselves and the casualty. When faced with an exposed casualty under direct enemy fire, which of the following actions best reflects the TCCC principle of utilizing cover and concealment for risk assessment? Option A. Engage the enemy directly to suppress their fire before attempting any casualty movement or care. Option B. Attempt to provide immediate medical care to the casualty in their exposed position, relying on the enemy's inability to accurately target. Option C. Move the casualty to the nearest available solid object that provides ballistic protection from enemy fire, even if it offers limited concealment. Option D. Utilize dense foliage or shadows to hide the casualty and the medic from enemy observation, without confirming the presence of ballistic protection. Correct answer is C. Move the casualty to the nearest available solid object that provides ballistic protection from enemy fire, even if it offers limited concealment. Explanation. This scenario is professionally challenging because it pits the immediate need for casualty care against the fundamental principle of force protection. The medic must rapidly assess the tactical situation to determine the safest and most effective way to provide care without becoming a casualty themselves. This requires a nuanced understanding of cover versus concealment and their application in a dynamic combat environment, directly aligning with TCCC principles. The correct approach represents best professional practice because it prioritizes the medic's safety and the security of the casualty by utilizing available cover. Cover provides ballistic protection, which is paramount in a firefight. Concealment, while useful for hiding, does not offer protection from enemy fire. TCCC guidelines emphasize that care under fire should only be rendered when the situation permits, and moving to cover to treat a casualty is a core tenet when feasible. This approach directly adheres to TCCC care under fire phase, which mandates that the rescuer must be able to provide care without becoming a casualty. An incorrect approach that focuses solely on immediate concealment without assessing for ballistic protection fails to meet TCCC standards. While hiding from enemy observation is important, it is secondary to surviving incoming fire. Relying on concealment alone when cover is available is a direct violation of force protection principles and TCCC emphasis on the rescuer's safety. This could lead to further casualties. Another incorrect approach that involves exposing oneself to enemy fire to reach the casualty without first attempting to suppress or evade the threat is a critical failure. TCCC mandates that the combatant medic's primary role is to fight and then provide medical care. Exposing oneself unnecessarily to enemy fire, even with the intent to render aid, is contrary to TCCC phased approach and the principle of self-aid first, then buddy aid, then corpsman/medic aid. This action directly endangers the medic and potentially the casualty by drawing more enemy attention. The professional decision-making process should involve a rapid threat assessment. First, determine if the enemy threat is suppressed, or if there is a viable avenue to move the casualty to cover. If immediate suppression or evasion is not possible, the medic must prioritize their own safety and the casualty's security by seeking available cover before initiating treatment. This iterative process of assessing the threat, seeking cover, and then providing care is the cornerstone of effective TCCC application in a combat zone. Question 3. Process analysis reveals that during an active engagement, a combatant sustains a severe penetrating limb wound with significant arterial bleeding. The casualty is still exposed to enemy fire, and the immediate threat to life is exsanguination. What is the most appropriate immediate action to take in accordance with Tactical Combat Casualty Care, TCCC, guidelines for care under fire? Option A. Apply a tourniquet to control the massive external hemorrhage. Option B. Attempt to pack the wound with hemostatic gauze while still under direct fire. Option C. Immediately move the casualty to a more secure location before any medical intervention. Option D. Assess the casualty for other injuries and provide reassurance. The correct answer is A. Apply a tourniquet to control the massive external hemorrhage. Explanation. Scenario analysis. This scenario is professionally challenging because the immediate threat of enemy fire creates a high-stress, time-sensitive environment where rapid decision-making is critical. The casualty's life depends on the rescuer's ability to quickly assess the situation, prioritize actions, and implement life-saving interventions under duress, all while maintaining situational awareness to avoid becoming a casualty themselves. The inherent chaos and danger of the combat zone necessitate a disciplined, protocol-driven approach. Correct approach analysis. The correct approach prioritizes immediate life threats and focuses on actions that can be performed under fire to prevent further hemorrhage and maintain an open airway. This aligns directly with TCCC guidelines for care under fire, which emphasize stopping massive external hemorrhage and addressing airway obstructions as the primary goals. The rationale is that without addressing these immediate threats, subsequent medical interventions will be futile. This approach is best professional practice because it is evidence-based, designed for the combat environment, and maximizes the casualty's chance of survival by addressing the most critical, preventable causes of death in the initial phase of care. It adheres strictly to the TCCC doctrine, which is the mandated standard for U.S. military medical personnel. Incorrect approaches analysis. One incorrect approach might involve attempting advanced airway management or detailed wound assessment before controlling massive hemorrhage. This fails to adhere to TCCC ABCs under fire, airway, bleeding, circulation, which are prioritized to address the most immediate life threats. Attempting complex procedures in a high-threat environment without first controlling bleeding significantly increases the risk to both the rescuer and the casualty. as it diverts attention and resources from the most critical intervention. This violates the core principle of TCCC to do the greatest good for the greatest number with the resources available under fire. Another incorrect approach could be to move the casualty to cover immediately, without any attempt to control bleeding. Moving to cover is a critical step in the tactical field care phase. Neglecting immediate hemorrhage control under fire can lead to the casualty succumbing to exsanguination before reaching a safer location. TCCC mandates that hemorrhage control is the absolute priority during care under fire, even if it means brief exposure to the threat. Failing to address this critical bleeding directly contravenes the TCCC directive to prevent death from hemorrhage, which is a leading cause of preventable death in combat. A further incorrect approach might be to focus solely on the casualty's comfort or reassurance without taking any life-saving actions. While morale is important, TCCC care under fire phase is strictly about immediate, life-saving interventions. Providing comfort without addressing the critical bleeding or airway issues is a failure to apply the prescribed medical protocols and represents a significant deviation from best professional practice in a combat casualty scenario. This approach neglects the fundamental purpose of TCCC, which is to save lives through specific, prioritized interventions. Professional reasoning. Professionals should utilize a decision-making framework that begins with a rapid threat assessment. If the threat is active, the rescuer must immediately identify and address life-threatening hemorrhage using tourniquets or hemostatic agents. Simultaneously, they must assess and manage the airway if it is compromised. This is followed by moving the casualty to cover as soon as tactically feasible. The TCCC guidelines provide a clear, sequential protocol that must be followed rigorously, emphasizing the do what you can, with what you have, where you are principal under fire. This systematic approach ensures that the most critical interventions are performed first, maximizing the casualty's survival chances in the chaotic and dangerous environment of care under fire. Question 4. Benchmark analysis indicates that a casualty with a severe penetrating abdominal injury, stabilized according to Tactical Combat Casualty Care, TCCC guidelines for tactical field care, is awaiting evacuation. The medic has controlled external hemorrhage and secured an airway. However, the casualty's condition remains unstable, with signs of ongoing internal bleeding and potential organ damage, requiring surgical intervention beyond the capabilities of the medic's current role. The evacuation platform is en route, but there is a significant delay expected before reaching the nearest Role 2 medical facility. Considering the trauma care continuum, what is the most critical action the medic should take during this waiting period to optimize the casualty's outcome? Option A. Continue to administer intravenous fluids aggressively in an attempt to fully restore the casualty's blood pressure before evacuation, as this is the primary goal of tactical field care. Option B. Focus solely on maintaining the casualty's airway and breathing, as these are the most immediate life threats and the medic's primary responsibility in TCCC. Option C. Initiate communication with the evacuation platform and the receiving Role 2 medical facility to provide a detailed casualty report and confirm their readiness to receive a critically injured patient requiring immediate surgical intervention. Option D. Attempt to perform a field tracheostomy to improve airway management, as the casualty's respiratory status is a concern and surgical intervention is anticipated. The correct answer is C. Initiate communication with the evacuation platform and the receiving Role 2 medical facility to provide a detailed casualty report and confirm their readiness to receive a critically injured patient requiring immediate surgical intervention. Explanation. Scenario analysis. This scenario presents a professionally challenging situation because it requires the medic to recognize and act upon a critical gap in the trauma care continuum, specifically the transition from tactical field care to the next echelon of care. The medic's immediate actions in the field are crucial, but understanding the limitations of their current capabilities and the requirements of the receiving medical facility is paramount for patient survival and optimal outcomes. Failure to anticipate and prepare for this handover can lead to delays, loss of critical information, and a breakdown in care. Correct approach analysis. The correct approach demonstrates a comprehensive understanding of the trauma care continuum by proactively identifying the need for advanced surgical intervention beyond the medic's scope. This involves not only stabilizing the casualty according to TCCC guidelines, but also initiating communication and coordination with the next echelon of care. This proactive engagement ensures that the receiving facility is prepared for the patient's specific injuries and needs, facilitating a smoother and more effective handover. This aligns with TCCC principles that emphasize the importance of timely evacuation and the seamless transition of care, ensuring the casualty receives the appropriate level of medical intervention as quickly as possible. Incorrect approaches analysis. One incorrect approach involves focusing solely on immediate field stabilization without considering the subsequent echelons of care. This fails to acknowledge the continuum and can lead to a patient arriving at a facility unprepared for their needs, potentially delaying critical interventions. This is a regulatory failure, as TCCC mandates consideration of evacuation and handover. Another incorrect approach is to assume the receiving facility will have all necessary resources and information without any proactive communication. This neglects the professional responsibility to ensure continuity of care and can result in a critical information gap, jeopardizing patient safety. This is an ethical failure as it prioritizes convenience over patient well-being. A third incorrect approach might be to delay evacuation beyond what is tactically feasible or medically indicated, in an attempt to provide more advanced care in the field than is appropriate or possible. This can expose the medic and casualty to increased risk and deviates from the TCCC principle of rapid evacuation when necessary. This is a procedural and potentially regulatory failure, as it misapplies TCCC guidelines regarding evacuation triggers. Professional reasoning. Professionals should employ a decision-making framework that integrates TCCC guidelines with an understanding of the broader medical evacuation and treatment chain. This involves 1. Performing immediate life-saving interventions according to TCCC phases: care under fire, tactical field care, tactical evacuation care. 2. Continuously assessing the casualty's condition and determining if their needs exceed the capabilities of the current echelon of care. 3. Initiating communication with the evacuation platform and receiving medical facility as early as tactically feasible. 4. Preparing a concise and accurate casualty report, e.g., using a DD Form 1380 or similar that includes all relevant information for the next echelon of care. 5. Anticipating the needs of the receiving facility and providing any necessary pre-arrival information or preparations. Question 5. Consider a scenario where a combat medic arrives at a casualty who has sustained a gunshot wound to the thigh with significant arterial bleeding and a concurrent head injury with altered mental status. The medic is under direct enemy fire. According to Tactical Combat Casualty Care (TCCC) guidelines, what is the immediate priority for this casualty? Option A. Immediately evacuate the casualty to the nearest medical facility. Option B. Control the massive hemorrhage from the thigh wound. Option C. Secure the casualty's airway and ensure adequate breathing. Option D. Assess the severity of the head injury and administer pain medication. The correct answer is B. Control the massive hemorrhage from the thigh wound. Explanation. This scenario is professionally challenging because it requires immediate, life-saving interventions under extreme stress and resource limitations, while adhering strictly to established TCCC protocols. The primary challenge lies in accurately assessing the casualty's condition and applying the correct TCCC phase of care without delay, as any deviation can have severe consequences. The decision-making process must be rapid, systematic, and based on a thorough understanding of TCCC principles. The correct approach represents best professional practice because it prioritizes immediate threats to life according to the TCCC guidelines. This systematic approach ensures that the most critical interventions are performed first, maximizing the casualty's chance of survival. Adherence to TCCC is not merely a guideline, but a critical standard of care in tactical environments, directly mandated by military medical doctrine and training requirements. An incorrect approach that focuses on non-life-threatening injuries first is a direct violation of TCCC care under fire phase. This phase mandates addressing massive hemorrhage and airway obstruction as the absolute priorities. Failing to do so means the casualty may succumb to preventable causes before more advanced care can be rendered, representing a critical failure in professional judgment and adherence to established life-saving protocols. Another incorrect approach that involves delaying treatment until reaching a higher level of care without performing immediate life-saving interventions ignores the core principle of TCCC. Do the greatest good for the greatest number. In a tactical setting, immediate on-site care is paramount. Delaying essential interventions like tourniquet application for severe extremity bleeding or airway management for an obstructed airway is a failure to provide timely and appropriate care, directly contravening TCCC foundational tenets. A further incorrect approach that involves improvising medical techniques not supported by TCCC guidelines is also professionally unacceptable. TCCC is a validated, evidence-based protocol designed to optimize outcomes in combat. Deviating from these established protocols without explicit justification or advanced training in alternative, proven techniques introduces unnecessary risk and can lead to adverse outcomes. This demonstrates a lack of discipline and a failure to rely on the established best practices that have been proven effective. The professional decision-making process in such situations should follow the TCCC phases: care under fire, tactical field care, and tactical evacuation care. Within each phase, the focus is on identifying and managing life threats in a specific order: massive hemorrhage, airway, breathing, circulation, and hypothermia. This systematic, phased approach, coupled with continuous reassessment, is the cornerstone of effective tactical casualty care. Question 6. The investigation demonstrates that during a tactical evacuation, a medic is faced with a casualty exhibiting severe, non-survivable injuries. The evacuation platform has limited capacity, and delaying departure to attempt prolonged resuscitation on this casualty would significantly increase the risk to the entire evacuation team and the mission due to incoming enemy fire and the need to reach a higher level of care for other, more survivable casualties. The medic must decide whether to continue evacuation with the current team and casualties, or to dedicate critical time and resources to the severely injured individual, potentially compromising the safety of all involved. Option A. Continue the evacuation with the current team and casualties, focusing on providing palliative care to the severely injured individual, while ensuring the safety and timely evacuation of those with a higher probability of survival. Option B. Request additional medical personnel and resources to the scene before initiating evacuation, regardless of the immediate tactical situation and risk. Option C. Dedicate all available medical resources and time to attempting a prolonged resuscitation of the severely injured casualty, even if it significantly delays the evacuation and increases the risk to the entire team. Option D. Abandon the severely injured casualty to expedite the evacuation of the remaining team and casualties. The correct answer is A. Continue the evacuation with the current team and casualties, focusing on providing palliative care to the severely injured individual while ensuring the safety and timely evacuation of those with a higher probability of survival. Explanation. This scenario presents a significant ethical dilemma within the context of tactical combat casualty care, TCCC, during tactical evacuation. Core challenge lies in balancing the immediate needs of a critically injured casualty with the operational realities and resource limitations inherent in a combat environment. The decision-maker must weigh the potential benefits of continued direct medical intervention against the risks and logistical complexities of delaying evacuation for a casualty who may have a low probability of survival, thereby potentially impacting the safety and mission effectiveness of the entire team. The correct approach prioritizes the principles of TCCC, which emphasize saving lives, preventing further casualties, and mission accomplishment. In this situation, the correct approach involves a rapid, evidence-based assessment of the casualty's condition and prognosis, considering the available resources and the time constraints of the evacuation. It requires a difficult but necessary judgment call based on the likelihood of survival and the impact on the evacuation timeline and the safety of the remaining team members. This approach aligns with the ethical imperative to provide the best possible care within the constraints of the operational environment, acknowledging that not all casualties can be saved, and sometimes the most ethical decision involves prioritizing those with a higher chance of survival and ensuring the safety of the mission. An incorrect approach that focuses solely on providing maximal medical intervention, regardless of the casualty's prognosis or the impact on the evacuation, would be professionally unacceptable. This would violate the principle of resource allocation in a tactical environment, potentially jeopardizing the evacuation of other casualties or the safety of the medical team and the unit. It could also lead to a futile expenditure of limited resources and time. Another incorrect approach, that of abandoning the casualty without a thorough assessment and consideration of all available options, would be a clear ethical and professional failure, violating the fundamental duty of care owed to any casualty. A third incorrect approach, that of delaying evacuation indefinitely to attempt a highly improbable resuscitation, would similarly disregard the operational realities and the safety of the entire unit, representing a failure to make a difficult but necessary decision. Professional decision-making in such situations requires a structured approach. This involves a rapid reassessment of the casualty using TCCC guidelines, a clear understanding of the evacuation platform's capabilities and limitations, and consultation with the unit commander regarding mission priorities and risk assessment. The decision-maker must be prepared to make a difficult judgment call based on the best available information, prioritizing the greatest good for the greatest number, while adhering to the principles of tactical medical care. Question 7. Upon reviewing a casualty in a hostile fire environment, you observe significant arterial bleeding from a leg wound, a possible fractured arm, and the casualty is conscious but disoriented. Which immediate action is mandated by Tactical Combat Casualty Care (TCCC) guidelines for this situation? Option A. Assess the casualty for a possible concussion due to disorientation. Option B. Apply a tourniquet to the bleeding leg wound. Option C. Attempt to splint the fractured arm. Option D. Administer pain medication for the fractured arm. The correct answer is B. Apply a tourniquet to the bleeding leg wound. Explanation. This scenario presents a professionally challenging situation due to the inherent chaos and resource limitations of a tactical combat environment. The need for immediate, life-saving interventions requires rapid assessment and decisive action, where misjudgment in prioritization can have fatal consequences. Core challenge lies in distinguishing between immediate threats to life and injuries that can be addressed later, all while under extreme pressure. The correct approach represents best professional practice because it strictly adheres to the established TCCC guidelines for casualty management. TCCC prioritizes interventions based on their impact on survival. The care under fire phase, which this scenario falls under, mandates addressing massive hemorrhage first, as uncontrolled bleeding is the leading cause of preventable death in combat. Following this, airway management and prevention of hypothermia are addressed if feasible and without compromising the mission or the casualty's immediate survival. This systematic, evidence-based approach ensures that the most critical interventions are performed first, maximizing the chances of survival for the most severely injured. This aligns directly with the TCCC doctrine, which is the sole regulatory framework for this certification. An incorrect approach that focuses on addressing less immediately life-threatening injuries, such as a fractured limb without active bleeding, before controlling massive hemorrhage, represents a significant regulatory and ethical failure, violates the fundamental TCCC principle of prioritizing interventions that directly prevent death. Ethically, it fails to uphold the duty of care by not addressing the most urgent need. Similarly, attempting complex procedures or prolonged assessment in the care under fire phase, when the environment is still hostile and immediate threats to life are paramount, is a failure to adhere to TCCC guidelines. This can expose both the rescuer and the casualty to further danger and divert critical resources and attention from life-saving measures. Professional decision-making in such situations requires a disciplined application of the TCCC phases. The rescuer must first identify the phase of care they are in. In care under fire, the primary directive is to stop bleeding and provide immediate life-saving interventions. This involves a rapid assessment for massive hemorrhage and addressing it with tourniquets or hemostatic agents. If the casualty is able to move, they should be moved to cover. Airway and breathing are addressed only if the casualty is unresponsive and there is no immediate threat of further injury. The decision-making process is a continuous loop of assessment, intervention, and reassessment, always guided by the TCCC protocols and the prevailing tactical situation. Question 8. Strategic planning requires a comprehensive understanding of established medical protocols to ensure the best possible outcomes for casualties in a tactical environment. Considering the foundational principles of Tactical Combat Casualty Care (TCCC), which of the following represents the most effective initial approach when encountering a casualty with severe extremity bleeding and signs of airway compromise under direct enemy fire? Option A. Immediately apply a tourniquet to the bleeding extremity and perform a rapid assessment for airway patency, clearing any obstructions if present. Option B. Focus on suppressing enemy fire and establishing a secure perimeter before attending to the casualty's injuries. Option C. Attempt to administer oral fluids to the casualty to combat potential shock while waiting for a medic. Option D. Prioritize locating and treating less severe injuries before addressing the bleeding and airway issues. The correct answer is A. Immediately apply a tourniquet to the bleeding extremity and perform a rapid assessment for airway patency, clearing any obstructions if present. Explanation. Scenario analysis. This scenario presents a common challenge in tactical environments where immediate, life-saving interventions are paramount, but the operational context introduces significant constraints. The professional challenge lies in balancing the immediate need for TCCC principles with the dynamic and often unpredictable nature of combat, including resource limitations and the risk of further casualties. Careful judgment is required to prioritize actions that offer the greatest chance of survival while mitigating risks to the rescuer and the mission. Correct approach analysis. The correct approach prioritizes the systematic application of TCCC guidelines, starting with immediate threats to life. This aligns directly with the core tenets of TCCC, which are designed to reduce preventable deaths on the battlefield. The emphasis on controlling massive hemorrhage, securing the airway, and preventing tension pneumothorax are the three leading causes of preventable death in combat and are addressed in this order by TCCC. This systematic, evidence-based approach represents best professional practice because it is proven to increase survivability. It is ethically mandated by the principles of battlefield medicine to provide the best possible care under the circumstances, and TCCC provides that framework. Incorrect approaches analysis. One incorrect approach might involve delaying critical interventions to gather more intelligence or await higher medical echelons without first addressing immediate life threats. This fails to adhere to the care under fire phase of TCCC, which mandates immediate action to stop bleeding and manage airway issues even under duress. Ethically, this delay could be considered a failure to act when action was clearly indicated and could have saved a life. Another incorrect approach could be to focus on less immediately life-threatening injuries before addressing massive hemorrhage or airway compromise. This violates the TCCC priority of addressing the killers first. It represents a failure to apply the established, evidence-based protocols of TCCC, which are specifically designed to address the most critical injuries first. A third incorrect approach might involve attempting advanced medical procedures beyond the scope of TCCC or the rescuer's training, or without adequate resources, potentially endangering the casualty or the rescuer. This deviates from the practical, mission-focused nature of TCCC and could lead to iatrogenic harm, a clear ethical and professional failure. Professional reasoning. Professionals should employ a decision-making framework that begins with a rapid assessment of the scene and the casualty. This assessment should immediately identify life-threatening conditions based on TCCC guidelines. The framework involves a sequential application of TCCC phases: care under fire, tactical field care, and tactical evacuation care. Within each phase, the rescuer must prioritize interventions based on the casualty's immediate needs and the tactical situation, always adhering to established protocols and their level of training. This systematic, protocol-driven approach ensures that the most critical interventions are performed in a timely and effective manner, maximizing the chances of survival. Question 9. Examination of the data shows a casualty presenting with a visible limb injury and complaining of pain. During the initial assessment, the rescuer notes the casualty is able to verbally respond to questions about their pain. Which of the following actions best aligns with the TCCC guidelines for assessing disability in this tactical scenario? Option A. Attempt a full neurological examination, including testing pupillary response and deep tendon reflexes. Option B. Immediately proceed to detailed wound packing and tourniquet application, as the casualty is verbal. Option C. Utilize the AVPU scale to systematically assess the casualty's level of consciousness, starting with determining if they are alert. Option D. Ask the casualty to describe the mechanism of injury in detail before assessing their responsiveness. Correct answer is B. Immediately proceed to detailed wound packing and tourniquet application, as the casualty is verbal. Explanation. Scenario analysis. This scenario presents a professional challenge due to the dynamic and potentially chaotic environment of tactical combat casualty care. The rapid assessment of a casualty's disability is critical for prioritizing treatment and evacuation, but it must be performed efficiently and accurately under extreme stress. Misinterpreting or overlooking signs of neurological impairment can lead to delayed or inappropriate interventions, directly impacting the casualty's survivability. The challenge lies in applying the TCCC guidelines for disability assessment consistently and effectively, even when faced with limited information or conflicting observations. Correct approach analysis. The correct approach, adhering strictly to TCCC guidelines, involves a systematic assessment of the casualty's level of consciousness using the AVPU alert, verbal, pain, unresponsive scale. This is the foundational step in the TCCC disability assessment. It is the best professional practice because it provides a standardized, rapid, and objective measure of neurological function that is directly applicable in a tactical setting. The TCCC curriculum emphasizes AVPU for its simplicity and effectiveness in quickly categorizing a casualty's responsiveness, which then guides further assessment and management decisions. This aligns with the TCCC principle of do the greatest good for the greatest number by enabling rapid triage and resource allocation. Incorrect approaches analysis. One incorrect approach involves relying solely on the casualty's ability to communicate their injuries. This is professionally unacceptable because a casualty with a significant neurological deficit may still be able to speak, even if their overall level of consciousness is impaired. This approach fails to adhere to the TCCC structured assessment and can lead to underestimating the severity of a head injury or other neurological compromise. It represents an ethical failure by potentially neglecting a critical aspect of the casualty's condition. Another incorrect approach is to skip the AVPU assessment entirely and proceed directly to detailed wound management. This is a regulatory failure as it bypasses a mandatory step in the TCCC casualty assessment flow. The disability assessment, including AVPU, is designed to be performed early in the March assessment: massive hemorrhage, airway, respiration, circulation, hypothermia, and head injury/hypothermia. Skipping it means crucial information about the casualty's neurological status is missed, potentially delaying life-saving interventions for traumatic brain injury or other central nervous system issues. A third incorrect approach is to attempt a comprehensive neurological exam, including testing reflexes and cranial nerves, in the initial tactical field setting. While a detailed exam is valuable in a hospital setting, it is not mandated or practical within the TCCC framework for initial casualty care. This approach is inefficient and deviates from the TCCC emphasis on rapid, life-saving interventions. It represents a professional judgment failure by applying inappropriate diagnostic depth for the tactical environment, potentially wasting valuable time and resources. Professional reasoning. Professionals should employ a decision-making process that prioritizes the TCCC guidelines as the primary framework. This involves understanding the rationale behind each step of the March assessment. For disability, the AVPU scale is the initial, critical tool. If the casualty is not alert, the rescuer must determine if they respond to verbal stimuli, pain, or are unresponsive. This initial categorization dictates the urgency and type of further neurological assessment and management. Professionals must constantly ask themselves, am I following the TCCC protocol for this phase of care? And does my assessment directly contribute to immediate life-saving interventions or critical decision-making for evacuation? The goal is always to provide the most effective care with the available resources in the shortest possible time. Question 10. Performance analysis shows a combat medic has assessed a casualty according to TCCC guidelines and determined that, despite all efforts, the casualty's injuries are unsurvivable. The unit commander, witnessing the medic's assessment, orders the medic to continue aggressive resuscitation efforts, stating that no one dies on my watch. Medic knows that these efforts will consume critical medical supplies and personnel time that are urgently needed for other casualties with a higher probability of survival. What is the most appropriate course of action for the medic? Option A. Politely but firmly inform the commander of the medical assessment, explaining that further aggressive resuscitation is medically futile according to TCCC guidelines and would divert resources from other casualties who can be saved, and request permission to transition to palliative care. Option B. Continue aggressive resuscitation efforts as ordered by the commander, despite the medical assessment of futility, to avoid insubordination. Option C. Immediately cease all medical care and inform the commander that the medic cannot comply with the order due to TCCC guidelines. Option D. Attempt a modified resuscitation that uses fewer resources but still appears to be aggressive, to appease the commander while conserving some supplies. The correct answer is A. Politely but firmly inform the commander of the medical assessment, explaining that further aggressive resuscitation is medically futile according to TCCC guidelines and would divert resources from other casualties who can be saved, and request permission to transition to palliative care. Explanation. This scenario presents a significant ethical dilemma within the TCCC framework, demanding a careful balance between immediate life-saving interventions and the broader principles of casualty care and resource allocation in a combat environment. The challenge lies in the commander's direct order, which conflicts with the medic's professional judgment based on TCCC guidelines and the patient's prognosis. Adhering strictly to a commander's order that contradicts established medical protocols, especially when it leads to potentially futile care or diverts critical resources from salvageable casualties, raises serious ethical and professional concerns. The correct approach prioritizes the TCCC principle of do no harm and the ethical obligation to provide care based on medical necessity and likelihood of survival. In a tactical environment, this means applying the March algorithm and making difficult decisions about resource allocation. When a casualty is deemed unsalvageable according to TCCC guidelines, continuing aggressive interventions is not only medically futile, but also ethically questionable, as it can consume valuable time, personnel, and supplies that could be used for casualties with a better chance of survival. This aligns with the TCCC emphasis on evidence-based care and the pragmatic realities of battlefield medicine. An incorrect approach would be to blindly follow the commander's order without professional medical assessment. This fails to uphold the medic's professional responsibility to provide appropriate care and could lead to the waste of resources and the neglect of other casualties. Another incorrect approach would be to refuse the order outright without attempting to explain the medical rationale, potentially creating insubordination issues without resolving the core medical ethical conflict. A third incorrect approach might be to attempt a compromise that still involves significant, medically unjustified intervention, thereby failing to adhere to the principles of TCCC and potentially prolonging suffering without benefit. The professional decision-making process in such situations requires clear communication, adherence to established protocols, and the courage to advocate for medically sound decisions. A professional would first assess the casualty using TCCC guidelines. If the casualty is deemed unsalvageable, they would respectfully inform the commander of the medical assessment and the rationale based on TCCC principles, explaining the futility of further intervention and the potential impact on other casualties. The goal is to educate and persuade, not to be insubordinate, while ultimately upholding the highest standards of casualty care. Question 11. Operational review demonstrates that during a recent simulated mass casualty incident, a medic encountered multiple casualties with varying degrees of extremity bleeding. One casualty presented with a deep laceration on the forearm, actively bleeding profusely, and not responding to direct pressure. Another casualty had a superficial abrasion on the hand with minor oozing. A third casualty had a significant arterial bleed from a thigh wound that was initially controlled with direct pressure, but began to rebleed heavily. Considering the TCCC guidelines for pre-hospital trauma care, what is the most appropriate immediate action for the medic regarding hemorrhage control for these casualties? Option A. Apply a tourniquet high and tight to the casualty with the forearm laceration. Apply a pressure dressing to the casualty with the hand abrasion, and reapply direct pressure with a dressing to the casualty with the thigh wound, escalating to a tourniquet if bleeding persists. Option B. Apply direct pressure to all bleeding sites, and if bleeding is not controlled after 5 minutes of continuous pressure, then consider tourniquet application for the extremity wounds. Option C. Apply a tourniquet to the casualty with the forearm laceration, apply a pressure dressing to the casualty with the thigh wound, and ignore the hand abrasion as it is not life-threatening. Option D. Apply a tourniquet to the casualty with the forearm laceration, apply a tourniquet to the casualty with the thigh wound, and instruct the casualty with the hand abrasion to apply pressure themselves. The correct answer is A. Apply a tourniquet high and tight to the casualty with the forearm laceration, apply a pressure dressing to the casualty with the hand abrasion, and reapply direct pressure with a dressing to the casualty with the thigh wound, escalating to a tourniquet if bleeding persists. Explanation. Scenario analysis. This scenario presents a common challenge in pre-hospital trauma care where limited resources and time pressure necessitate rapid, accurate decision-making. The core difficulty lies in balancing the immediate need to control hemorrhage with the potential for exacerbating other injuries or compromising circulation if tourniquets are applied incorrectly or unnecessarily. Adherence to TCCC guidelines is paramount to ensure the best possible outcome for the casualty. Correct approach analysis. The correct approach, which involves assessing the casualty for life-threatening hemorrhage and applying a tourniquet only when direct pressure is ineffective for severe extremity bleeding, directly aligns with the TCCC guidelines for tactical field care, TFC. TCCC prioritizes controlling massive hemorrhage as the first step in pre-hospital trauma care, because uncontrolled bleeding is the leading cause of preventable death in combat casualties. The guidelines emphasize a systematic approach. Identify the bleeding, attempt direct pressure, and if that fails, apply a tourniquet high and tight on the affected limb. This method ensures that life-saving interventions are applied promptly and appropriately, minimizing risks associated with overtreatment. Incorrect approaches analysis. Applying a tourniquet immediately upon seeing any bleeding, without first attempting direct pressure, fails to adhere to the TCCC stepwise approach. This can lead to unnecessary tourniquet application, potentially causing nerve damage, tissue ischemia, and increased pain for the casualty, while delaying definitive care for other life-threatening injuries. It also deviates from the principle of using the least restrictive intervention necessary. Failing to apply a tourniquet despite visible, life-threatening extremity hemorrhage that is not controlled by direct pressure is a critical failure. This directly contradicts the TCCC mandate to control massive bleeding, which is a primary cause of preventable death. Such inaction would represent a significant ethical and professional lapse, potentially leading to the casualty's death from exsanguination. Applying a tourniquet to a casualty with minor bleeding that can be controlled with direct pressure, or to a junctional wound where a tourniquet is not indicated, is also incorrect. TCCC guidelines specify the appropriate use of tourniquets for severe extremity bleeding. Misapplication increases the risk of complications and does not address the immediate life threat effectively, while potentially causing harm. Professional reasoning. Professionals should employ a decision-making framework that prioritizes the TCCC March algorithm. This involves assessing for massive hemorrhage first. If life-threatening external hemorrhage is identified, the next step is to control it. This includes attempting direct pressure. If direct pressure is ineffective, then a tourniquet is indicated for extremity bleeding. For junctional hemorrhage, hemostatic dressings or wound packing are the preferred methods. This systematic, evidence-based approach ensures that the most critical threats are addressed first, using the most appropriate interventions according to established protocols. Question 12. Analysis of the core principles of tactical combat casualty care, TCCC, reveals its profound impact. Which of the following best describes the primary reason for TCCC importance extending beyond the immediate battlefield into various civilian emergency scenarios? Option A. TCCC main contribution is in standardizing the complex administrative paperwork required for casualty reporting in any emergency situation. Option B. TCCC is primarily valuable for its advanced surgical techniques that are only applicable in combat surgical units. Option C. TCCC significance is solely confined to active military combat operations and has no practical application in civilian settings. Option D. TCCC provides a structured, evidence-based approach to managing life-threatening injuries in high-stress, resource-limited environments, which are common in civilian mass casualty incidents and tactical EMS operations. The correct answer is D. TCCC provides a structured, evidence-based approach to managing life-threatening injuries in high-stress, resource-limited environments, which are common in civilian mass casualty incidents and tactical EMS operations. Explanation. Scenario analysis. This scenario is professionally challenging because it requires understanding the fundamental purpose and application of tactical combat casualty care, TCCC, principles beyond a purely military context. The challenge lies in recognizing that TCCC's structured approach to battlefield medicine, designed for extreme environments, offers significant advantages in optimizing care delivery and improving outcomes in various high-stress, resource-limited civilian situations. The judgment required is to identify which civilian scenarios most closely mirror the conditions TCCC was developed to address. Correct approach analysis. The correct approach represents best professional practice because it directly aligns with the core tenets of TCCC, providing the best possible care to casualties under difficult circumstances. TCCC emphasis on systematic assessment, immediate life-saving interventions, and efficient casualty evacuation is directly transferable to civilian mass casualty incidents, Mackay, active shooter events, or remote wilderness rescues. These situations often involve uncontrolled bleeding, compromised airways, and shock, all of which are primary concerns addressed by TCCC. The regulatory and ethical justification stems from the universal principle of preserving life and limb, which TCCC effectively facilitates by providing a standardized, evidence-based framework that optimizes the use of limited resources and personnel in chaotic environments. Incorrect approaches analysis. One incorrect approach fails to recognize the adaptability of TCCC by limiting its relevance solely to active combat zones. This is a regulatory failure as it ignores the documented evidence and widespread adoption of TCCC principles in civilian emergency medical services, EMS, and disaster response, which are implicitly governed by the same overarching ethical duty to provide effective care. It represents a failure to optimize available knowledge and training. Another incorrect approach misunderstands TCCC focus by suggesting its primary benefit is in advanced surgical techniques. This is an ethical failure because TCCC prioritizes immediate, life-saving interventions that can be performed by personnel with varying levels of training, not necessarily advanced surgical skills. Overemphasizing advanced procedures in a TCCC context misrepresents its scope and can lead to inappropriate resource allocation and delayed essential care. A third incorrect approach incorrectly posits that TCCC importance is primarily in its administrative documentation requirements. While documentation is crucial in any medical setting, it is a secondary outcome of care delivery, not the primary driver of TCCC importance. This is a professional reasoning failure, as it prioritizes process over patient outcome, which is contrary to the fundamental ethical obligation of medical care. TCCC value lies in its life-saving protocols, not its paperwork. Professional reasoning. Professionals should approach situations requiring casualty care by first identifying the environmental and situational stressors. If these stressors include uncontrolled bleeding, airway compromise, shock, or a chaotic environment with limited resources, TCCC principles should be considered. The decision-making process involves assessing the casualty's condition against the TCCC phases: care under fire, tactical field care, tactical evacuation care, and applying the appropriate interventions. This requires a mindset of proactive, evidence-based intervention tailored to the specific challenges of the environment, prioritizing immediate life threats and efficient movement to definitive care. Question 13. Stakeholder feedback indicates that during tactical field care, a casualty is found with significant bleeding controlled but is shivering violently and has damp, cool skin. What is the most appropriate immediate action regarding exposure and environmental control? Option A. Focus solely on monitoring the casualty's vital signs and wait for evacuation to a medical facility for rewarming. Option B. Apply direct heat sources to the casualty's skin to rapidly increase core temperature. Option C. Remove wet clothing, cover the casualty with dry materials, and initiate active rewarming measures as soon as feasible. Option D. Continue to manage other injuries and address environmental control only after all bleeding is definitively stopped and the casualty is stable. The correct answer is C. Remove wet clothing, cover the casualty with dry materials, and initiate active rewarming measures as soon as feasible. Explanation. Scenario analysis. This scenario is professionally challenging because it requires immediate, life-saving interventions under extreme environmental duress, where the casualty's core temperature is rapidly dropping. The medic must balance the urgency of treating other life-threatening injuries with the critical need to prevent and manage hypothermia, which can exacerbate bleeding and impair cognitive function. Failure to address hypothermia effectively can directly lead to increased mortality, even if other injuries are managed appropriately. The medic's judgment is tested in prioritizing actions and resource allocation in a high-stress, resource-limited environment. Correct approach analysis. The correct approach prioritizes preventing further heat loss and initiating rewarming as quickly as possible, aligning directly with TCCC guidelines for environmental control. TCCC emphasizes that hypothermia is a treatable cause of death and that measures to prevent it should be implemented concurrently with other life-saving interventions. This involves removing wet clothing, covering the casualty with dry materials, and using external heat sources if available. This proactive and integrated approach directly addresses the physiological impact of cold on casualty survival and is the cornerstone of TCCC environmental control doctrine. Incorrect approaches analysis. One incorrect approach fails to recognize the immediate threat of hypothermia and focuses solely on other injuries. This violates TCCC principle of treating hypothermia as a concurrent life threat. By neglecting to address the casualty's core temperature, the medic allows a potentially reversible cause of death to progress, directly contravening best practices for casualty survival. Another incorrect approach might involve delaying rewarming efforts until the casualty is in a more secure location or after all other treatments are completed. This is a critical failure because hypothermia progresses rapidly in exposed conditions, and the window for effective intervention narrows with time. TCCC mandates immediate action to prevent further heat loss and initiate rewarming. A further incorrect approach could involve using inappropriate rewarming methods that could cause harm, such as direct application of extreme heat without protection, which could lead to burns. While TCCC emphasizes rewarming, it also implicitly requires safe and effective methods, prioritizing the casualty's overall well-being. Professional reasoning. Professionals should employ a systematic decision-making process that integrates TCCC 3 phases: care under fire, tactical field care, and tactical evacuation care. In this scenario, during tactical field care, the medic must continuously assess the casualty for signs of hypothermia and implement environmental control measures, concurrently with hemorrhage control and airway management. The decision-making process should involve 1. Rapid assessment of the casualty's environmental exposure and signs of hypothermia. 2. Immediate implementation of heat loss prevention measures, removing wet gear covering. 3. Concurrent initiation of rewarming efforts as resources allow. 4. Continuous reassessment of the casualty's condition, including temperature status, throughout all phases of care. This integrated, phased approach ensures that all life threats, including environmental ones, are addressed promptly and effectively. Question 14. The monitoring system demonstrates a respiratory rate of 16 breaths per minute, but the casualty is exhibiting paradoxical chest movement and is unable to speak. According to Tactical Combat Casualty Care (TCCC) guidelines, what is the immediate priority for assessing and managing the casualty's breathing? Option A. Continue monitoring the casualty, assuming the monitoring system is accurate and the paradoxical movement is a minor anomaly. Option B. Attempt to recalibrate the monitoring system before proceeding with any interventions. Option C. Immediately initiate positive pressure ventilation based on the observed paradoxical chest movement and inability to speak, overriding the monitoring system's rate. Option D. Focus on the monitoring system's reported respiratory rate of 16 and consider it adequate, while observing for further changes. The correct answer is C. Immediately initiate positive pressure ventilation based on the observed paradoxical chest movement and inability to speak, overriding the monitoring system's rate. Explanation. This scenario is professionally challenging because the casualty's condition is dynamic, and the monitoring system provides data that requires interpretation within the TCCC framework. The medic must quickly assess the reliability of the data and integrate it with their direct observation to make life-saving decisions under pressure. The TCCC guidelines are paramount, emphasizing rapid assessment and intervention to prevent death from the bloody death, silent killer, and hypothermia. The correct approach represents best professional practice because it prioritizes the TCCC guidelines for assessing breathing. This involves a systematic evaluation of chest rise and fall, air movement, and the casualty's ability to speak or vocalize, which are the primary indicators of effective respiration. TCCC guidelines are designed for austere environments where advanced monitoring may be unreliable or unavailable, thus stressing the importance of direct assessment. Relying on the monitoring system alone without corroborating direct assessment is a failure to adhere to the TCCC emphasis on hands-on, rapid evaluation. An incorrect approach that relies solely on the monitoring system's data without direct assessment fails to meet TCCC standards. The TCCC explicitly mandates a layered approach to assessment, starting with visual and tactile checks. If the monitoring system indicates a breathing rate that contradicts direct observation, e.g., showing normal breathing when the casualty is clearly apneic or gasping. The medic must trust their direct assessment and TCCC protocols over potentially faulty equipment. This failure to prioritize direct assessment constitutes a significant deviation from TCCC best practices and could lead to delayed or incorrect interventions, directly violating the core principles of TCCC aimed at saving lives. Another incorrect approach would be to dismiss the monitoring system's data entirely without attempting to reconcile it with direct assessment. While direct assessment is primary, understanding potential discrepancies can inform further investigation or indicate equipment malfunction. However, in a critical care scenario, the immediate priority is always to ensure the casualty is breathing effectively. Professionals should use a decision-making framework that integrates TCCC guidelines with available resources. This involves 1. Initial TCCC assessment, airway, breathing, circulation, etc. 2. Corroborating findings with available monitoring systems. 3. Prioritizing direct assessment and TCCC protocols when discrepancies arise or monitoring is questionable. 4. Acting decisively based on the most reliable information to provide immediate life-saving care. Question 15. Research into tactical combat casualty care, TCCC protocols indicates that during an engagement where a casualty is exposed to direct enemy fire, what is the primary immediate action a medic should take regarding the casualty? Option A. Focus solely on returning fire and neutralizing the enemy threat before any medical assessment. Option B. Attempt to perform a detailed wound assessment and apply advanced dressings while still in the line of fire. Option C. Begin administering intravenous fluids and pain medication to stabilize the casualty. Option D. Immediately move the casualty to a safer location or cover while suppressing the threat. The correct answer is D. Immediately move the casualty to a safer location or cover while suppressing the threat. Explanation. Scenario analysis. This scenario is professionally challenging because it demands immediate, life-saving actions under extreme duress and threat. The primary challenge lies in balancing the urgent need to provide medical care with the overriding imperative of personal and unit security. Hesitation or incorrect prioritization can lead to further casualties, mission failure, and ethical breaches. The combat environment dictates that tactical considerations must inform medical interventions. Correct approach analysis. The correct approach prioritizes stopping immediate threats and moving casualties to cover before initiating medical care. This aligns directly with TCCC guidelines, specifically the care under fire phase. The core principle is that a casualty cannot be effectively treated if they are still under direct enemy fire. TCCC mandates that the rescuer's safety and the security of the area are paramount. Moving to cover is the first step to enable any form of casualty care, even if it's just basic bleeding control. This represents best professional practice because it adheres to the established, evidence-based TCCC protocol designed to maximize survival rates in combat by integrating medical care with tactical realities. It is ethically sound as it aims to save the most lives by ensuring the rescuer's survival and ability to provide care, and by addressing the most immediate life threats, hemorrhage, in a survivable manner. Incorrect approaches analysis. One incorrect approach would be to immediately attempt advanced medical interventions without securing the casualty's safety or moving them to cover. This violates the fundamental TCCC principle of combat scene safety and casualty evacuation to cover. Ethically and regulatorily, this is a failure because it places the rescuer in unnecessary danger, potentially creating more casualties, and it is unlikely to be effective as the casualty is still exposed to lethal force. TCCC guidelines are clear that definitive care is not possible under direct fire. Another incorrect approach would be to ignore the casualty and focus solely on returning fire, even if the immediate threat has subsided or can be suppressed. While returning fire is critical, TCCC emphasizes that once the immediate threat is suppressed or the casualty is moved to cover, medical intervention becomes a priority. Ignoring a casualty when it is tactically feasible to provide aid, even basic aid, could be seen as a failure to uphold the duty of care within the TCCC framework. This approach fails to integrate medical readiness with tactical action. A third incorrect approach would be to attempt to drag the casualty to cover without first controlling obvious, life-threatening hemorrhage. While moving to cover is essential, TCCC guidelines for the care under fire phase specifically include identifying and controlling massive external hemorrhage as a critical immediate action, even in a tactical setting. Failing to address immediate bleeding while moving, if possible, represents a deviation from best practice and could result in the casualty succumbing to exsanguination before reaching safety. Professional reasoning. Professionals should employ a decision-making framework that integrates the TCCC phases. First, assess the tactical situation. Is there direct enemy fire? Is the area secure enough to provide care? Second, prioritize personal and unit safety. Third, if under fire, the immediate action is to suppress the threat and move the casualty to cover. Once in cover, the tactical field care phase begins, which includes identifying and controlling massive hemorrhage, opening the airway, and providing respiratory support. This phased approach ensures that medical interventions are performed in the most survivable manner, respecting the realities of the combat environment. Question 16. The performance metrics show a consistent trend of casualties experiencing complications during evacuation due to inadequate preparation. Considering the TCCC framework, which of the following actions is the most critical step in preparing a casualty for evacuation to ensure their continued survivability and facilitate effective handover to higher medical echelons? Option A. Administering strong analgesics to ensure the casualty is comfortable during transit, regardless of other interventions. Option B. Focusing solely on securing the casualty's position and ensuring they are stable for movement, without prioritizing specific medical interventions. Option C. Initiating immediate evacuation without further assessment if the casualty is conscious and able to communicate, to minimize time spent in the tactical environment. Option D. Confirming that all life-threatening bleeding has been controlled, the casualty's airway is patent, and they are protected from environmental hazards to prevent hypothermia, while ensuring the TCCC card is completed and attached. The correct answer is D. Confirming that all life-threatening bleeding has been controlled, the casualty's airway is patent, and they are protected from environmental hazards to prevent hypothermia, while ensuring the TCCC card is completed and attached. Explanation. Scenario analysis. This scenario presents a professionally challenging situation because the decision-making process for preparing a casualty for evacuation under TCCC guidelines requires a rapid, accurate assessment of multiple factors, balancing immediate life-saving interventions with the logistical realities of transport. The challenge lies in prioritizing care that maximizes the casualty's survivability during transit, which can be unpredictable and fraught with further risks. Misjudging the urgency or appropriateness of specific preparations can directly impact the casualty's outcome. Correct approach analysis. The correct approach emphasizes ensuring the casualty is stable for transport and that all necessary information and equipment accompany them. This aligns directly with TCCC care under fire, tactical field care, and evacuation phases. Specifically, it focuses on maintaining airway, controlling hemorrhage, preventing hypothermia, and ensuring adequate pain management, all critical for survivability during movement. The inclusion of the DD Form 1380 TCCC card is a regulatory requirement for tracking casualty care and informing receiving medical personnel, ensuring continuity of care and adherence to established protocols. This comprehensive preparation maximizes the chances of a positive outcome during the evacuation phase. Incorrect approaches analysis. One incorrect approach might focus solely on immediate pain relief without adequately addressing life-threatening bleeding or airway compromise. This fails to adhere to the TCCC march sequence: massive hemorrhage, airway, respiration, circulation, hypothermia/head injury, which prioritizes interventions based on their immediate impact on survivability. Another incorrect approach could involve delaying evacuation due to minor discomforts, neglecting the urgency of moving a casualty to a higher level of care when indicated, thereby violating the principle of timely evacuation. A third incorrect approach might be to omit essential documentation like the TCCC card, which is a critical regulatory failure leading to a breakdown in communication and potentially inadequate care at the next echelon. Professional reasoning. Professionals should employ a systematic decision-making process rooted in TCCC principles. This involves a rapid reassessment of the casualty's condition, prioritizing interventions according to the march sequence, and considering the tactical environment and available resources. The decision to prepare for evacuation should be based on the casualty's stability for transport, the urgency of reaching definitive care, and the ability to provide necessary interventions en route. Documentation and communication are paramount, ensuring that all relevant information is passed to the receiving medical team. Question 17. The evaluation methodology shows a combat medic encountering a casualty with a penetrating chest wound, exhibiting signs of respiratory distress and unilateral decreased breath sounds. The medic suspects a tension pneumothorax. Which of the following actions, strictly adhering to TCCC guidelines, is the most appropriate immediate management? Option A. Attempt to close the penetrating chest wound with an occlusive dressing. Option B. Administer intravenous morphine for pain management. Option C. Evacuate the casualty immediately to a higher level of care without further intervention. Option D. Perform needle decompression at the second intercostal space in the midclavicular line. The correct answer is D. Perform needle decompression at the second intercostal space in the midclavicular line. Explanation. The evaluation methodology shows a combat medic facing a casualty with a penetrating chest wound, exhibiting signs of tension pneumothorax. The professional challenge lies in the immediate, life-saving intervention required under extreme battlefield conditions, where definitive care is distant and resources are limited. The medic must rapidly assess, prioritize, and execute a procedure that carries inherent risks but is critical for survival. This scenario demands not only technical proficiency, but also sound ethical judgment regarding the balance of risk and benefit in a life-or-death situation, adhering strictly to TCCC guidelines. The correct approach represents best professional practice by prioritizing the immediate threat to life, as dictated by TCCC care under fire, and tactical field care phases. Specifically, the TCCC guidelines mandate needle decompression for suspected tension pneumothorax in casualties with penetrating chest trauma and respiratory distress. This intervention directly addresses the physiological derangement causing rapid deterioration and is the established standard of care in this environment. It aligns with the ethical principle of beneficence, acting in the patient's best interest to preserve life, and the principle of non-maleficence by performing a procedure that, while invasive, is less harmful than allowing the casualty to succumb to the tension pneumothorax. An incorrect approach of delaying needle decompression to await further assessment or evacuation without attempting immediate life-saving intervention fails to adhere to TCCC urgent intervention protocols. This constitutes a regulatory failure by not following established TCCC guidelines for managing a life-threatening condition. Ethically, it breaches the duty of care and the principle of beneficence by allowing a preventable death. Another incorrect approach of attempting a surgical intervention beyond the scope of TCCC guidelines or the medic's training, without addressing the immediate tension pneumothorax, is also a regulatory and ethical failure. It deviates from TCCC emphasis on appropriate interventions for the given phase of care and the medic's skill set, potentially causing further harm, maleficence, and wasting critical time. A further incorrect approach of administering pain medication without addressing the life-threatening airway or breathing compromise would be a significant regulatory and ethical failure. While pain management is important, it is secondary to immediate life threats. Prioritizing comfort over survival violates TCCC phased approach and the fundamental ethical obligation to stabilize critical conditions first. The professional decision-making process for similar situations should follow the TCCC algorithm. Identify and manage immediate life threats, airway, breathing, circulation, shock, then address other injuries. This involves rapid assessment, applying the appropriate TCCC skill for the identified problem, and continuous reassessment. Ethical considerations are integrated throughout, ensuring actions are guided by the patient's best interest, adherence to established protocols, and the medic's scope of practice. Question 18. Which approach would be most appropriate for a TCCC-certified medic to employ when assessing a casualty who has sustained multiple traumatic injuries in a tactical environment, ensuring all potential life-threatening conditions are identified? Option A. Perform a quick visual scan of the casualty, focusing only on areas that appear obviously injured, and then proceed with basic life support. Option B. Prioritize providing pain relief and reassurance to the casualty, delaying a thorough physical examination until the casualty is in a more stable and comfortable state. Option C. Conduct a systematic head-to-toe assessment, meticulously examining each body region from the scalp to the toes for any signs of injury, regardless of the initial presenting wound. Option D. Immediately address the most visible and severe wound, dedicating all immediate attention to its management before considering other potential injuries. The correct answer is C. Conduct a systematic head-to-toe assessment, meticulously examining each body region from the scalp to the toes for any signs of injury, regardless of the initial presenting wound. Explanation. Scenario analysis. This scenario is professionally challenging because a medic operating in a tactical environment must rapidly and accurately assess a casualty under extreme stress, with limited resources and the constant threat of further injury. The casualty's condition can deteriorate quickly, necessitating a systematic and thorough approach to identify all life-threatening injuries. Failure to perform a detailed head-to-toe assessment can lead to missed injuries, delayed or incorrect treatment, and ultimately, a worse outcome for the casualty. The medic's judgment is critical in prioritizing interventions while ensuring a comprehensive evaluation. Correct approach analysis. The correct approach, which involves a systematic head-to-toe assessment, represents best professional practice in TCCC because it directly aligns with the established protocols and guidelines designed to maximize casualty survival in combat. TCCC emphasizes a structured approach to care, beginning with immediate life-saving interventions, care under fire and tactical field care, and progressing to more detailed assessments and treatments. The head-to-toe assessment performed during tactical field care ensures that no potential injury is overlooked. This systematic method, moving from the head to the feet, allows for the identification of external and internal injuries, including penetrating trauma, blunt force trauma, fractures, and neurological deficits. Adherence to this structured assessment is a core tenet of TCCC, ensuring that all critical information is gathered to guide subsequent treatment decisions, thereby fulfilling the ethical and professional obligation to provide the highest standard of care under battlefield conditions. Incorrect approaches analysis. Focusing solely on the most obvious injury, such as a visible extremity wound, without conducting a full head-to-toe assessment, represents a significant regulatory and ethical failure. This approach risks overlooking critical, less apparent injuries like a tension pneumothorax, abdominal bleeding, or a head injury, which can be immediately life-threatening. Such a failure violates the TCCC principle of comprehensive casualty management and the medic's duty to provide thorough care. Prioritizing comfort measures over a systematic assessment, while seemingly compassionate, is also a professional failure in this context. While comfort is important, it must not supersede the identification and treatment of life-threatening injuries. In a tactical combat casualty scenario, the primary ethical and professional imperative is to preserve life and limb. Delaying or omitting a critical assessment for comfort is a dereliction of duty under TCCC guidelines. Performing a rapid, superficial scan without a structured methodology is another failure. While speed is often necessary, a lack of systematic progression means that specific areas or types of injuries might be missed. This haphazard approach deviates from the TCCC requirement for a detailed assessment, increasing the likelihood of diagnostic errors and suboptimal treatment, which is professionally unacceptable. Professional reasoning. Professionals should employ a decision-making framework that prioritizes the TCCC guidelines. This involves first recognizing the phase of care, e.g., tactical field care. Within that phase, the framework dictates a systematic approach to assessment. The medic should mentally or verbally, if training, run through the head-to-toe checklist, ensuring each body region is examined for signs of injury. This systematic process, coupled with an understanding of common combat injuries and their potential presentations, allows for efficient and effective identification of all problems. If a specific injury is identified, the medic should still complete the head-to-toe assessment to rule out other concurrent injuries before focusing solely on treating the initial finding. This ensures a holistic approach to casualty management, consistent with TCCC best practices. Question 19. The review process indicates a combat medic is treating a casualty with a severe, rapidly bleeding wound to the thigh. The medic observes bright red blood spurting rhythmically from the wound. The casualty is becoming increasingly pale and diaphoretic, with a weak, rapid pulse. The medic has access to standard TCCC equipment. Which of the following actions best reflects the immediate TCCC priority for managing this type of hemorrhage? Option A. Apply a tourniquet high and tight on the affected limb. Option B. Assess for signs of internal bleeding. Option C, pack the wound with hemostatic gauze. Option D, apply direct pressure to the wound. The correct answer is A. Apply a tourniquet high and tight on the affected limb. Explanation. This scenario presents a professionally challenging situation because it requires immediate, life-saving decisions under extreme stress, with potentially limited information and resources. The medic must accurately identify the type of hemorrhage to apply the most effective TCCC intervention, directly impacting the casualty's survival. The challenge lies in distinguishing between external and internal bleeding, as well as recognizing the urgency of arterial versus venous bleeding, all while adhering strictly to TCCC guidelines. The correct approach represents best professional practice because it prioritizes the most life-threatening hemorrhage first, aligning with the March algorithm's emphasis on massive hemorrhage control as the initial critical step. Applying direct pressure and a tourniquet for obvious external arterial bleeding is a direct, evidence-based TCCC intervention that can rapidly control catastrophic blood loss. This action is directly supported by TCCC guidelines, which mandate immediate control of external hemorrhage. An incorrect approach of focusing solely on a superficial wound without assessing for deeper or internal bleeding is a regulatory and ethical failure. It violates the TCCC principle of addressing the most immediate life threats first. Failing to consider or manage potential internal hemorrhage, even if external bleeding appears controlled, is a failure to provide comprehensive care and could lead to delayed or missed critical interventions, violating the ethical duty to preserve life. Another incorrect approach of attempting to pack a deep, actively bleeding wound without first applying a tourniquet for arterial bleeding is also a failure. While wound packing is a valid TCCC technique for junctional or deep wounds, it is secondary to controlling catastrophic arterial hemorrhage with a tourniquet. Delaying tourniquet application in such a case can result in irreversible shock and death, a direct contravention of TCCC life-saving mandate. The professional decision-making process for similar situations should involve a rapid, systematic assessment following the March algorithm. First, identify and control any obvious, life-threatening external hemorrhage using direct pressure and tourniquets as indicated by TCCC guidelines. Simultaneously, maintain situational awareness for signs of internal hemorrhage, e.g., abdominal distension, bruising, mechanism of injury. If external bleeding is controlled and signs of internal bleeding are present, consider appropriate TCCC interventions for internal hemorrhage management within the scope of pre-hospital care, such as rapid evacuation. Always prioritize the most immediate threat to life. Question 20. The analysis reveals a combat casualty presenting with a visible, actively bleeding laceration on the abdomen, alongside signs of labored breathing and a rapid, thready pulse. Which of the following initial actions best aligns with the TCCC primary survey approach for this casualty? Option A. Focus on controlling the abdominal hemorrhage with tourniquets and pressure dressings before evaluating the casualty's breathing. Option B. Administer pain medication for the abdominal wound, and then proceed to assess the casualty's pupils and reflexes. Option C. Immediately begin direct pressure and wound packing on the abdominal laceration while simultaneously assessing the casualty's level of consciousness. Option D. Secure the airway with manual maneuvers and assess for spontaneous breathing, while also considering the need for cervical spine stabilization. Correct answer is C. Immediately begin direct pressure and wound packing on the abdominal laceration while simultaneously assessing the casualty's level of consciousness. Explanation. Scenario analysis. This scenario presents a combat casualty with potential for multiple life-threatening injuries, requiring rapid and systematic assessment under extreme pressure. The challenge lies in prioritizing interventions based on the approach, ensuring that immediate threats to life are addressed before moving to less critical issues. The chaotic environment and potential for obscured injuries necessitate a disciplined adherence to TCCC guidelines. Correct approach analysis. The correct approach prioritizes the airway with C-spine control, breathing, circulation, disability, and exposure/environment. This systematic progression, as mandated by TCCC, ensures that immediate threats to oxygenation, ventilation, and perfusion are identified and managed first. Failure to address these can lead to rapid deterioration and death, irrespective of other injuries. TCCC emphasis on this sequence is a direct reflection of battlefield realities where time and resources are limited, and the most critical interventions must be performed first to maximize survivability. Incorrect approaches analysis. Focusing solely on a visible extremity bleed without assessing airway or breathing is a critical failure. This violates the TCCC principle of addressing life-threatening conditions in order of priority. A casualty can bleed out, but they can also suffocate or have their circulation compromised by tension pneumothorax or severe internal hemorrhage, which would be missed by such a narrow focus. This approach demonstrates a lack of systematic assessment and adherence to established protocols, leading to potential preventable deaths. Attempting to manage a suspected head injury, disability, before ensuring adequate circulation is also a significant deviation. While neurological status is important, profound shock or airway compromise will render any neurological assessment or intervention moot. TCCC prioritizes the physiological support systems, ABC, before detailed neurological evaluation, as these are the immediate determinants of survival. Prioritizing wound packing for a deep laceration on the torso, before assessing for signs of a tension pneumothorax or severe internal bleeding is another failure. While hemorrhage control is vital, it must be integrated within the broader EBDE framework. A tension pneumothorax, for example, can present with signs of shock and respiratory distress that might be misinterpreted or overshadowed by external bleeding, but requires immediate decompression. Not just wound packing. Professional reasoning. Professionals must internalize the TCCC EBDE approach as a non-negotiable framework. In any casualty situation, the immediate mental checklist should be: is the airway open and protected? Are they breathing effectively? Is their circulation intact? And are there signs of severe hemorrhage? Only after these critical physiological functions are assessed and managed should attention turn to neurological status and environmental exposure. This systematic, prioritized approach ensures that the most immediate threats to life are addressed, maximizing the casualty's chance of survival in a high-stress, time-sensitive environment.